The STERRAD 100NX sterilization system with ALLClear technology is a general-purpose, low-temperature sterilizer. In this video, we will provide an overview of the STERRAD 100NX sterilization system with ALLClear technology, covering pre-cycle system diagnostics, available cycles, inserting a STERRAD 100NX sterilizer cassette, load preparation and reprocessing, how to cancel a cycle, the STERRAD velocity system, and some general utilities and maintenance. Prior to beginning the cycle, the STERRAD 100NX sterilizer with ALLClear technology will run an automatic pre-cycle system diagnosis and load conditioning phase. The load conditioning process minimizes the number of sterilization cycle cancellations by detecting system problems and correcting load issues. This process completes in about 5 minutes and occurs prior to the start of the selected sterilization cycle. If a load issue is detected, the sterilizer will attempt to correct it. If ALLClear technology cannot correct the issue, the selected sterilization cycle will not be started and a notification will be displayed on the screen. By utilizing the ALLClear technology, problems with a load can be detected prior to the hydrogen peroxide being injected. The ALLClear technology is available in the standard, flex, and express cycles. Let's review the available cycles and what can be reprocessed in the STERRAD 100NX sterilizer with ALLClear technology. The available cycles are standard, flex, duo, and express. The standard cycle is 47 minutes and should be selected for general metal and non-metal medical instruments, including hinge devices, and single-channel stainless steel lumens with an internal diameter of 0.7 millimeters or larger and a length of 500 millimeters or shorter. Typical devices would include arthroscopy and laparoscopic instrument sets, eye instruments, cameras and light cords, rechargeable batteries, orthopedic drills and saws, and ultrasound probes. The flex cycle is 42 minutes and should be selected for single-channel flexible endoscopes with an internal diameter of 1 millimeter or larger and a length of 1,065 millimeters or shorter. A maximum of 2 flexible endoscopes can be processed per load. The duo cycle is 60 minutes and should be selected for medical devices such as light cords and cameras and flexible endoscopes with an internal diameter of 1 millimeter or larger and a length of 875 millimeters or shorter. A maximum of 2 flexible endoscopes with light cords can be processed per load. The express cycle is 24 minutes and should be selected for general medical devices requiring surface sterilization or sterilization of instruments with hinged stainless steel and titanium surfaces, rechargeable batteries, and non-lumen rigid or semi-rigid endoscopes, eye instruments, and general surgery devices, such as Da Vinci 3D endoscopes. Check with the medical device manufacturer's instructions when selecting the proper sterilization cycle. When a new STERRAD 100NX sterilizer cassette is required, when the cassette in the sterilizer is expired, or if there is no cassette installed, the screen will display the message, "Please insert new cassette." As a precaution, when handling any part of the system or load items that have been exposed to hydrogen peroxide, please wear the appropriate PPE, chemical-resistant latex, PVC/vinyl, or nitrile gloves. Refer to the glove manufacturer's instructions for use for more information. To insert a new cassette, first, take a new cassette out of the carton. Each cassette contains 10 sealed capsules of around 58% aqueous hydrogen peroxide solution. There are 2 cassettes per case. Once the cassette is removed from the case, examine the packaging carefully before opening it. Check the expiration date. If the cassette is expired, do not use it. Observe the leak indicator strip on the wrapped cassette. If it indicates a leak, the strip changes from white to red. If the strip is red or you see droplets of moisture, do not open the package. It's possible that hydrogen peroxide has leaked inside the package. Refer to the cassette instructions for proper handling instructions. Position the cassette so that the arrows are pointing straight into the cassette door slot of the sterilizer. Do not insert the cassette at an angle and do not use excessive force. If the cassette is inserted incorrectly, the sterilizer will eject the cassette, and the screen will ask the operator to remove and reinsert the cassette. Insert the cassette into the cassette slot until the system detects and pulls the cassette in. The use of the cassette in the STERRAD 100NX Sterilizer with ALLClear technology is controlled by the RFID label. The label limits the use of a cassette to the appropriate sterilizer and ensures that cassettes are not used beyond their shelf life. When a cassette is empty, the sterilizer automatically moves it to the cassette disposal box. The screen displays a message instructing you which actions to take next. When the cassette disposal box contains 2 cassettes, it is full and you must dispose of the full cassette disposal box. Never reuse a cassette disposal box. Once removed, a new cassette disposal box must be inserted. Let's talk about preparing a load and reprocessing in the STERRAD 100NX Sterilizer with ALLClear technology. Prior to reprocessing, all individual devices should be cleaned, rinsed, and thoroughly dried according to the manufacturer's instructions for use. Check the manufacturer's instructions for use or the STERRAD Sterility Guide to determine which cycle the device has been validated for. Only STERRAD instrument tray systems and Aptomax instrument trays are recommended for use in the STERRAD 100NX Sterilizer with ALLClear technology. These instrument trays are specially designed to allow diffusion of hydrogen peroxide and plasma around every item in the load. STERRAD instrument tray mats and holders are available to pad the Aptomax instrument trays. Never use linen foam pads or cellulose, as they may absorb the hydrogen peroxide and cause the cycle to cancel. Use only STERRAD sterilizer-compatible polypropylene sterilization wrap and Tyvek pouches. Tyvek pouches and rolls with STERRAD chemical indicators are the only pouches and rolls available on the market that are validated by ASP. If you are using rigid containers cleared by the FDA for use in the STERRAD 100NX Sterilizer, follow the instructions for use provided by the manufacturer. Verify that the rigid containers are cleared for use in each sterilization cycle. STERRAD chemical indicator strips and SealSure chemical indicator tape offer a method to verify that the load has been exposed to hydrogen peroxide in the sterilizer. Chemical indicators are not a substitute for biological indicators. Place a STERRAD chemical indicator strip inside the tray container or pouch. Notice that the lot number and expiration date are not printed on each individual STERRAD chemical indicator strip. Secure all wrapped trays with SealSure chemical indicator tape. The expiration date for the SealSure chemical indicator tape is located on the inside of the roll. The STERRAD chemical indicator strips and SealSure chemical indicator tape change from red to yellow when exposed to hydrogen peroxide. Yellow indicates processed and red indicates unprocessed. Be sure to store the STERRAD chemical indicator strip indicator box and SealSure chemical indicator tape away from heat and light. Detailed information on loading and packaging can be found in your user's guide, but the following are some basic guidelines. Arrange items within a tray to ensure proper diffusion of H2O2 throughout the load. Do not stack instruments within trays or containers. Place Tyvek pouches on the edges if possible, and arrange them so that the transparent mylar side of the pouch faces the opaque side of the next pouch. Do not stack pouches and do not stack trays in the chamber. Do not place trays within trays or place wrapped instruments within wrapped trays. You can obtain additional cycle information by pressing the information icon at the bottom of the cycle on your STERRAD 100NX Sterilizer with ALLClear technology ready screen. The screen will display information about the cycle and a list of items that can be sterilized in the selected cycle. When placing the load on the shelves, do not block the ultraviolet lamp beam in the front right side of the chamber. Ensure the load is centered on the shelves and that the shelves are centered in the chamber. Do not allow metal objects to come into contact with the walls of the chamber, the door, or the electrode. Contact with the walls, door, or electrode can cause a cycle cancellation and/or damage the item or the sterilizer. Leave at least 1 inch or 25 millimeters of free space between the load and the electrode. As a reminder, after selecting a cycle, the system will instruct the operator to load the chamber. The screen will show instructions on how to load the chamber per the selected cycle. Select the desired cycle and press Start. The ALLClear technology process begins and is displayed on the monitor. This is a load conditioning process that minimizes the number of sterilization cycle cancellations by detecting system problems and correcting load issues. Once the ALLClear technology process completes successfully, the sterilizer starts a countdown clock and begins the sterilization. When the cycle is complete, the green Cycle Completed screen is displayed, indicating a successfully completed cycle. In addition, the STERRAD 100NX Sterilizer with ALLClear technology loudspeaker emits one long beep. A series of 10 short beeps indicates a canceled cycle. Ensure that the chemical indicators on or in the sterilized packages exhibit the correct color change, and that the cycle printout shows that all parameters were met. Additionally, the system screen will display the cycle status as process complete. The load is now ready for immediate use following your hospital or healthcare facility's policy. If the chemical indicators do not exhibit the correct color change, investigate the cause, and then repackage the devices and reprocess. There may be occasions when it is necessary to cancel the cycle before it is completed. To cancel a cycle, simply touch the Cancel Cycle button, and the screen will display a confirmation message. As a precaution, when handling any part of the system or load items that have been exposed to hydrogen peroxide, please wear the appropriate PPE, chemical-resistant latex, PVC/vinyl, or nitrile gloves. Refer to the glove manufacturer's instructions for use for more information. Loads from canceled cycles should be rewrapped using new packaging materials, STERRAD chemical indicator strips, and SealSure chemical indicator tape. If a biological indicator was used in the canceled load, the previously used biological indicator must be disposed of per your hospital or healthcare facility's policy, and a new biological indicator must be placed in the chamber before restarting. To maintain the highest patient safety, ASP recommends monitoring each sterilization cycle with a STERRAD Velocity Biological Indicator (BI/Process Challenge Device (PCD). When using the STERRAD Velocity system, the following steps should be followed. Step 1. Prepare the STERRAD Velocity Biological Indicator (BI/Process Challenge Device (PCD) as specified in the instructions for use. Step 2. After selecting the desired cycle, follow the on-screen instructions to scan the barcode with the sterilizer scanner. Step 3. Place the STERRAD Velocity BI/PCD as specified in the instructions for use. Step 4. Start the cycle and wait for the process to complete. Step 5. Once the cycle completes, put on protective gloves and remove the BI/PCD from the chamber. To ensure proper use of the STERRAD Velocity Biological Indicator and the STERRAD Velocity Reader, please reference their corresponding instructions for use and user's guide. The BI must be placed in the STERRAD Velocity Reader within the time frame specified in the instructions for use. The system will ask the user to contact an ASP representative if the reader detects 2 out of 3 test biological indicators are positive. You will continue to receive this warning after each sterilization cycle completion until 2 consecutive STERRAD Velocity Reader test BIs are negative. For detailed information on interpretation of results, please review the instructions for use included with the biological indicator and the STERRAD Velocity Reader User's Guide. If your STERRAD system is integrated with a STERRAD Velocity Reader, the user will not be notified of negative test biological indicators. The sterilizer will be alerted when the STERRAD Velocity Reader detects a positive test biological indicator. Follow the current hospital or healthcare facility's policies and procedures regarding quarantine or retrieval and reprocessing of potentially non-sterile instruments and notification of the physicians. Note that if the STERRAD Velocity Reader detects a positive test biological indicator when the sterilization cycle is running, the notification screen will only appear after the completion of the sterilization cycle. All known potential loads since the last negative test biological indicator results are listed on your screen. Touch the Confirm button on the screen to acknowledge the test BI used in the load has a positive result. Let's review some general utility and maintenance components. The STERRAD 100NX Sterilizer with ALLClear technology should always remain on. But if you need to turn it off, the main power switch is located on the left side of the sterilizer. When it is not in use, the system will automatically go into sleep mode. If it is in sleep mode, just tap the screen and the color display appears. Let's go over how to change the printer paper. The printer is located on the front panel and prints cycle reports on a roll of thermal paper. To replace the paper, open the door, squeeze the handle, and pull the door towards you. Drop in the new roll of paper and align the paper in the center. The paper should fall over the top. The top button advances the paper. Let's talk about maintenance. The hydrogen peroxide monitor lens is located inside the opening and must be kept clean. Clean the lens once every 3 months or when an accumulation of debris is present. Be advised that the hydrogen peroxide monitor uses an ultraviolet light source located inside the chamber behind the door. To avoid eye injury, do not stare directly at the ultraviolet light source for an extended period of time. To clean the lens, first put on chemical-resistant latex, PVC vinyl, or nitrile gloves. Then moisten a lint-free cloth with isopropyl alcohol and wipe the lens to remove any accumulated debris. Never use an abrasive cleanser. The Duo cycle requires the sterilizer to hold peroxide in a reservoir to optimize sterilization. If this peroxide expires, you must dispose of the peroxide remaining in the system. Peroxide clearance must be performed when a message appears. Otherwise, no subsequent Duo cycles can be run. First, make sure the chamber is empty, then touch the yellow notification area, and then touch the Begin Clearance to begin peroxide clearance. Planned maintenance on the STERRAD 100NX Sterilizer with ALLClear technology is based on time or cycle count. When it is time for planned maintenance, a message will display on the printout and on the touchscreen interface. Call the ASP help desk when the message is received, so the maintenance can be scheduled. Let's look at what's in the utility screen. Cycle history data is stored in the sterilizer's memory, which holds the most recent 200 cycles. After 200 cycles are completed, the oldest cycle history record is overwritten with new data from the 201st cycle. When you see the message "Memory card full," it is an indication that the cycle history must be downloaded, or you can select OK to continue with overriding the stored data. When you touch the View Cycle History button on any screen where the button appears, the program displays the Select Cycle History screen. The list box shows the cycle number, status, completion date and time, and reason for cancellation, if applicable, for all cycle history records currently in the sterilizer's memory. This concludes our overview of the STERRAD 100NX sterilization system with ALLClear technology. For complete equipment information, warnings, and instructions, please read and follow the user guide before use.